Resume recording. Place your name and campus in the chat. Ensure that your screen name shows how it appears on the roster, you all. Don't forget about, these sessions are recorded and they're viewed by the attendance administrator. So just remember all those things that we're supposed to be doing to adhere to the guidelines. The last class takes their exam on Friday. It ends right at 5 o'clock Eastern time. And so that's when the exam analysis will take place on Friday at 5 p.m. Eastern time. Shortly after, it usually doesn't take us more than an hour to do the exam analysis. Then an announcement will be placed in the announcement section, alerting you to look for your grade. Prior to then, we just move on and get ready for the next exam. We don't give out thumbs up or frowny faces, all those different things, any raw scores or anything like that. So again, place your name and campus in the chat. Ensure that your screen name appears how it appears on the roster. If you do need to change it, those little three dots, those are listed to the right. Click it, a bar pops out, and rename yourself. As always, these sessions are recorded and can be viewed by the attendance administrators. So welcome to week 3. This is exam week. There isn't any official content, so we'll just start the conversation for the next 2 weeks, because we meet next week, which is week 4 and 5, and then let me just share my screen, and then the next exam, it comes pretty quickly. So for those of you all that might not have heard it, the announcement, we let Miss Pugh in, then I'll say it again. And again, if you're having to not be on camera for any reason, just put a message in the chat. Make sure you just send it to me. You have to step away, use the restroom or something, just a short step away. Just continue to do that so that the attendance administrators won't be confused about why you're not on camera. The last class takes their exam on Friday. It should end right around 5 o'clock Eastern time. The exam analysis will start at that time. Once the exam analysis is finished, then you will receive an announcement in the announcement section that alerts you that your exam scores are there. It can take up to an hour, but it will not take any longer than an hour to do the exam analysis. So no preliminary scores will be given out. Place your name and campus in the chat. All right, so let's see where we're at. So now that you've taken exam 1 for most of your classes, I think some of you all that are taking another class, week 4, you're taking that first exam. So start looking now at your schedules, your clinical schedules, work, home, all those different responsibilities that you have, and see what things need to be revised, rearranged, and pause, that you can put on pause and or delete. So just be looking at that. You all are right here at the end. And so week 11 isn't far away. It is the same amount of time, but it seems like once we take this first exam, it seems like time just goes by really fast. So just don't let time, creep up on you. And so just be looking at your schedules here. Let me go ahead and share, and we'll look and see where we're going. So the next exam covers the big topics. The huge concepts are communication. Share my screen here, my little mouse doing something, y'all. Okay, so here we go. It does cover communication. And then even though we just have these 2 big headings, communication, looking at those that are on the healthcare team, and also leadership, it doesn't seem like it's that much, but there's several moving parts to that. So we have communication, which we'll do a deep dive in next week. We'll just talk briefly about communication here for a few minutes, and then leadership, and then those that are on the healthcare team. So those are the huge concepts. And then, of course, week 6, we have our exam. So I'm just going to just talk a little bit here so let me refer back to my little notes here. So what is this communication and these others that are on the healthcare team? There are so many that makes up the healthcare team. But believe it or not, the nurse, you will be that person that everybody's going to be coming to. The physical therapist, the doctor, the dietitian, everyone's going to come to you. You're going to be like that central hub, and expecting you to kind of guide and lead and, communicate effectively about what is going on. They may say, well, what do you think in regards to, for example, if a patient has a follow-up appointment with a outside doctor, they have to follow up with the cardiologist or whomever. But then also, so the setting is that we'll just say the long-term care facility or the person's at home. So physical therapy or speech, one of the therapists, they're coming in. So we do know that the client should at least be attempted to engage in those therapies in order for that insurance to keep on paying for that service. Because if they keep writing down, if the therapist keeps writing down that the client is not available or refuses the care, or the client, the insurance companies, they kind of look at it as is that client has, come to a halt. And what they'll do a lot of times is they'll stop those services that they're trying to offer. So we have a client at home or either in the long-term care facility. So the client's receiving physical therapy. And these are the things I'm just making up just so that you can kind of just think it through when we're talking about communication and all those that are on the healthcare team. We have the same client who's supposed to go see the cardiologist or the endocrinologist. And so the endocrinologist can get the patient in on April 22nd at 7 p.m. But this is the same time that usually the speech therapist comes in. And so what should we do? Should we just let the client just go to the endocrinologist and miss the appointment with the speech therapist? Or should we be communicating with both in this and see if there's a different time and date for that appointment and or a different date and time that client can get that therapy done? There might be some leeway in that client schedule where they can maybe move for that one day, since that might be the only opening that specialist has. Then that speech therapist might can adjust the schedule and then allow for it. But in the event that at the most, we want to make sure that client get both of those services. But it's going to take that communication and effective communication, clear communication from the nurse, because the client might not really understand, well, hey, you really do need both. So it's up to us to make sure that we're communicating clearly with the patient so that they can make an informed decision. Now, if that client comes and say, hey, I don't want to do therapy, I understand that we might can adjust the schedule, but I just want to skip it. So, but also let them know, well, hey, if we skip therapy this week, they're going to note that you're refusing. And we're going to support them in whatever they decide, but you do want to let that patient know so that they can make an informed decision. So,
Professor,
mhm, yeah,
um, is you sharing your screen? Cause we're not seeing.
nothing. It's nothing to look at. We're just talking. I'm just
Okay.
briefing you over where we're going.
Okay.
Just trying to
Okay.
get you to be thinking about communication. Those are just scenarios that I'm making up. So
Okay.
those main concepts are communication and leadership, and all those on the healthcare team. It is rare that those questions, those next gen questions, are going to ask you, well, what is the definition of communication? It's going to be that you're going to have to apply it to all these situations. So I'm just making up these little things here. So no, we're just talking through it, just trying to shape your thoughts for, we know what communication is, but the example that I just gave you involved others on the healthcare team. It was two other people, and then you, that nurse, that's going to be that central piece, is going to have to kind of guide and shape and ensure that we are communicating um, competently with that patient. Like I said, that patient can refuse and say, well, hey, this will be my opportunity to skip out on therapy. Sometimes they'll do that, but we want to make sure that client is making an informed decision, and we're going to support them. We're going to advocate, for them as well. So as healthcare providers, let me back up. So as healthcare providers, in order to keep our license, some states call them units, some states call them different things, but what it is you have to complete some continuing education, whether or not it's units or blocks or whatever. That's one of the components to maintain your license. So usually that is where the nurse will do an analysis of themselves and say, well, hey, I'm working in this setting. So what should I focus on to sign up for to continue my education? Because we're all, we're life learners as healthcare providers. And we want to stay up on the latest information. So we would decide on which conferences, which webinars we actually attend based on what we've evaluated that we need improvement on. And then also we want to consider that setting that we're working in, because there are certain seminars and webinars that are specific for those settings that we're working in. So as healthcare providers, we want to be competent. And what that means is we're continuously evaluating and improving our skill set, our knowledge base with the latest information so that we can provide that best care for our clients. So we have to do an analysis depending on what setting we're in. Consider the setting that you're working in, and also whether or not if you're changing that setting, because you don't want to just be doing continuous education and it's not specific to the setting and it's not going to build upon your foundation. We want to make sure that the information that we're getting is the latest evidence based. While facilities, policies, and procedures should align with what our Nurse State Practice Act says, we want to make sure that we stay up on the latest information. So communication competence in nursing requires both effective and appropriate communication. What is this appropriate communication? So we want to make sure that when we're communicating, that is in the person's, first language. That is a level that they understand. We may have to bring in an interpreter. We may have to repeat, restate, et cetera, to ensure that what we're communicating to our patients and our clients, that it's clear that they can make an informed decision. Okay, so with me saying that, let me do a what if. What should the nurse do? So the situation is the client, and this will happen sometimes, and maybe you may have already experienced this while you're out, have been out in your clinicals. A patient, the nurse will go in the room and the patient will say, "Hey, I just signed off on that consent. The doctor was in here looking at me and I just signed off on it." But then they'll confide in you, I still have more questions. Or I want to know if there's an alternative. Do I have to do this procedure or receive this treatment? What should that nurse do in the instance that that client or that patient says, "Well, I just signed off on that consent, but I still have questions. I want to know if there's an alternative." Someone come off mute and just say what you think that nurse should do.
Contact the physician and let the physician know that they changed their mind.
Exactly. Even though they've signed off on that consent, it does not mean they can be signed off on the consent, put them on the elevator, going up to surgery or down to surgery, whichever way you go. They can change their mind right in that moment. Oh, not even if they don't want to know what the alternative is. If they just say, "Hey, I wanted this done and I've just changed my mind," you are correct. We notify that healthcare provider. Say, "Hey, the patient says they signed off on the consent, but they still have more questions. They're unclear or whatever it is that they're saying." They say they want to know, what are some alternative treatments. And so, because remember, we are advocating for this client and we want that client to make an informed decision. So if they need more information or if they decide to change their mind, even if someone is leaving against medical advice, we do let them know, "Hey, this is against, your best interest. But in the event that you still want to leave, you can. We can't hold you against your will, but right now it's just not in your best interest." Okay, let me give you another example.
Even under a narcotic, because once the consent is signed and you give them a controlled substance for the procedure, some people having a reaction, they're talking out their head. So
Exactly. So so you're giving them the narcotic and they're talking out of their head and they say, "I just signed it. I changed my mind," or "I want to know if there's an alternative." You still let them know, because we're really not sure if that narcotic is really affecting them or not. So we could, because they have stated to you, "I've changed my mind," or "I want to know if there's an alternative," because we want to make sure. So define advocacy in the chat. Everyone just send this message out. Let's give you like 2 minutes. If we are saying that we are this patient advocate, we're advocating for this client. Define advocacy. Put it in your own words. Put it on minute and a half. Just take your time and just explain to us, what do you think advocacy, or you being that, or the nurse being this client's advocate, what does that mean? Trying to find my little timer. 1 minute 36. And just send it out to everyone. So we are responding to our understanding of what being a client advocate or advocating for our client, or we're defining what advocacy is. Place it in the chat. Speaking up for the patient about what they want and don't, being the voice. We're looking out for the best interests of the patient, representing the client needs and wants, speaking out. Because with that situation that you just described, we would not want it to move forward. And it really was that client really was saying, hey, you all, I did want to change my mind. We just rather, use the extra time, call the delay, and ensure. And then, of course, we're going to also give the situation. Remember, I'm kind of leading into the next thing when we're talking about communication. What is that tool that the Institute of Medicine pretty much we use in healthcare to ensure that our communication is structured so that we don't forget anything when we're communicating with another healthcare provider? What's that tool called?
SBAR.
SBAR. So let's go back to that situation. So we added in this client has taken some medication and we believe it has changed or altered their mental status. So that we're going to communicate, but we're going to add that piece in. That situation is, hey, this client has signed off, but now they're stating they don't want to the procedure, or they're stating they need more information, or they're stating they need an alternative. In addition to that, we add, this client has just taken whatever, a medication, pain medication, whatever it is. And, now their orientation is they only orient times one. They're drowsy. We will give all that supportive data because we would just want to just ensure, because we just said that we are being the voice for the patient. We're taking the necessary steps to give your patient proper care. Look at the responses that are in there. So taking that extra time out to put things on pause. Good. Let's see, what was the other situation that I said? I'll come back to that part. So we talked about SBAR. So what does the S, the B, the A, and the R mean?
Situation, background, assessment, and
recommendation.
Got it. So whether or not we are handing off to the doctor, to the next nurse, like we're going home and they're coming on, or vice versa, and or if we're calling the healthcare provider to give an update on that client, we still use that SBAR. Like I said, it keeps our communication structured. So what if we got our little information aligned by the SBAR? The patient had went and had lab work done. And so the lab calls and says, hey, we're calling to report the patient in room 201. They have a critical potassium level. They have a critical white count. We have called or used the method that is recommended by that facility's policy to contact that healthcare provider to alert them about the information that we have on this client. Okay, so let me back up. This is the situation. Talking about communication. A lab person, they called and said, hey, patient in room 201, their white count is abnormal, and it is whatever it is. Their potassium is abnormal, and it is. Or radiology has called and says, hey, that chest x-ray on the patient in 201, we're calling because we have abnormal results. And they are. Because rarely do they call to report normal results. If something is abnormal, usually they have like a gauge that says how abnormal it is before they make that call. So anyways, they've called and we answered the phone. We've taken that information. So we got all of our information lined up according to SBAR. The situation is we're calling to report an abnormal finding for this client. And the facility's policy is that we call the answering service for the doctor, that we page the doctor. There are all types of ways that we communicate with the healthcare provider. We've done that, and there is no response from that doctor. Because usually, even with the answering service, usually in the facilities policies and procedures, it says like if you haven't received a response, and they give like this approximate time frame, 5 or 10 minutes. What should that nurse do? Okay, so the situation, let me back up. The nurse took the call, or they received the electronic communication that the patient's labs or radiology report is abnormal. Nurse got her information together according to the SBAR. She's contacted the healthcare provider, and we'll just say that the policy is that the doctor should call back within 5 to 10 minutes. There's no response. That nurse looks back at the policy again, may even ask the team member, well, hey, has it changed? The way that we notify the healthcare provider, the team member say, oh no, whatever the procedure is. The second time, there's still no response. What should that nurse do? Just pass it on to the next shift?
I would send them out.
Say that again.
I would send them out to the emergency room if I'm at a nursing home. I mean, I don't know.
I wouldn't know. You shouldn't know. You should get it straight before you leave because that's not the next nurse's responsibility. What happened on your shift should be handled on your shift.
I mean, I don't know what else we would do if the doctor don't call. I mean,
Yeah, but
bad.
you just got to stay on top of it. I mean, you may want to let the other nurse know, but you want to get some kind of resolve because you're actually leaving a
Mm.
situation for a nurse that wasn't there all day. You're going to give her a report, yes,
Yeah.
but she still wasn't there when all this stuff went down.
Okay, so let me put y'all on pause. It's not shift change. It
Yeah.
is not
Okay.
shift change. The nurse,
Okay.
so that's an
Okay.
example of if it's shift change, but even
Okay.
still, we're taking care of it. But go back to the scenario. What is the main concept in this scenario, you all? Is it the point that we want to pass something on to the next nurse? What is the main point in this scenario?
No,
That
we
we
want to
want to make
notify
sure
the
that this
doctor.
patient is good.
We want to
The patient's
notify
safety
this
is
healthcare
first.
provider of this abnormal result. That's that's the main point. And the person is not contacting us. They're not responding via the electronic health record, because they have all these ways you can communicate. There's no response. In the event that we just
Another
document and
doctor.
say, hey, we tried to contact the doctor and I'm just going to pass on to the next shift, that equals failure to respond for that nurse. So then that nurse that did not reach out to their team leader, the charge nurse, depends on what facility you're in, they have different titles. It could be the charge nurse, the team leader, the director, the ADON. That nurse should move to that chain of command, to that next person. Everybody answers to somebody. Well, hey, I've tried to attempted to contact the healthcare provider. I verified the process. There's still no response. So that nurse needs to notify whoever that next person is in that chain of command. We can't just leave it hanging out there, because if we do, something happens to this client. Who is it going to fall on? That lab that called, that
You,
radiology person that called, or the nurse?
the nurse.
The nurse.
Is it going to be on the healthcare provider?
No, the nurse.
The nurse. So we have to say, okay, so when you go to sit in your, you all are getting ready to start interviewing, because you're going to start deciding on your settings and things that you're going to work in. That's a question that you need to ask. Well, hey, what do we do in the event that we can't contact? And it is rarity. This is something I'm just making up. But sometimes, with this connectivity, the way that it is on both sides, something might not go through, but we cannot leave that client hanging. It's never okay to just say, okay, we couldn't get in touch with anybody. Let me just pass it on to the next nurse. You are right on that. We want to move it up our chain of command, because usually there's an alternate way to contact someone. Even if that we can't contact that direct healthcare provider, usually they have a plan in place where there's another person, an alternative person that we contact in the event that that we're not getting a response. But the main concept of that little scenario that I gave you is that we don't want it to be that the nurse failed to report. So it's not enough. We just said we're advocating for this client. So it's not good enough for us just to know that this client has an abnormal finding that they've called to us or reported to us, and we just pass it on. We need to pass it on to that healthcare provider or whomever their alternative person is. Okay. And so all of that was communication. And so that's where we're going with the communication piece. So we're advocating and to guide us and be our compass, we want to think about moral principles, respecting the client's right to make their own decisions. What are the standards? What's on the nurse's to-do list that they can lawfully or legally do. We don't want to step outside of those realms. So we should continuously advocate in a professional manner to ensure that our clients make informed decisions. And as we're moving up that chain of command, let me throw another scenario out there, talking about this chain of command and communicating. What if in the event that there's an emergency? So now we have a situation where we walk past room 201 and the client, there's a change in status. This client is unstable. Or if we went in and we're checking vital signs and this blood pressure is extremely high or extremely low, this client needs an immediate action. Do we wait and pass that information on to the charge nurse, or do we go ahead and attempt to contact that healthcare provider? What you think?
I don't know, because maybe the RN needs to,
What if you're in a
What-
long-term care facility or you're at the home?
Oh,
If they're
okay,
home,
long-term care.
you're
Okay.
it. Remember, you're going to be that person.
I'm gonna help the patient first, then call the doctor. I
So
mean,
what do you mean by help the patient?
because you said what did you say? The blood pressure was extremely high
Or
or
low, or it could have been that they went in, they were slumped over.
well, I'm gonna attend to the patient. I mean, because the patient could die by the time you get in contact. I mean, I would do
So are we
whatever
gonna
I need to
call
do.
the team leader, or are we gonna go ahead and call that healthcare provider?
I would say call the team leader, and maybe she can call the healthcare provider or you could call the healthcare provider while she's doing whatever needs to be done. I don't, you know what I'm
So,
saying? Like,
so this is an emergent situation.
well, I
So do
say
we,
help the patient.
meaning we call that healthcare provider? So that's a time when we would bypass the chain of
Oh,
command because
oh,
this client needs something urgently. This is not just haphazardly. Okay, no, this is an emergent. Just like with
okay.
that,
So
go ahead. What you say?
no, no, no. I just kind of got a little bit confused with your scenario. I don't know. This has just been a day, but I guess I'm thinking if they need CPR, but you said blood pressure. I mean, I don't know. I'm just
Okay.
gonna.
So if it's an emergency situation, usually we follow the chain of command, but in the event that the client needs an immediate response, then we wouldn't have to, we're going to notify the team leader, but right then we would need to notify whomever is responsible for giving that immediate response for us. So let me just back it up. Let's change the scenario. This client was delivered a tray, where, for example, say the meal tray, the patients got a new order for Puree. The tray came out to the client and it was still regular food. It was not mechanical soft. It was just a regular hamburger. You could clearly identify what it was. So this client needs an immediate response. It's mealtime. They're serving out. Is this something that we want to, just report to the team leader, or do we need to directly go and notify the dietary department?
You need to
This
go to the
client needs
dietary department.
this client needs an immediate response. So if they
Yeah,
need an
going to
immediate
get that
response,
food.
who's responsible for giving it that immediate resolution or
The nurse,
solution to the issue? So
The
we would
dietary,
notify who?
the dietary.
Dietary.
your nurse, the dietitian.
Got it. Okay. So this communication thing, and you go back to your definition that you put in there, we're advocating for these clients. And so we'll be in all different types of situations, but nevertheless, we are being honest with our clients. We're not changing rules just because we think it, may make them feel bad. We don't want to practice out of our scope. We want to be honest. We want to establish those therapeutic relationships early on so they will express their ideas and opinions and what plans they actually have for them. And then we want to use like these I statements We want to make sure that we're communicating. Like I said, we need to bring in an interpreter. If we need to repeat, restate, make sure that we're, well, I've said that 3 times. You might have to restate it or repeat it. And then have them to restate what they said. And then also you repeat it, it asks for clarification from them. So just mix it up, especially if it seems like communication is not being received, because it's communication involves a sender and a receiver. So the person misinterprets what was sent, then you're at a standstill or a halt, because what was sent out was not what was really interpreted. So this communication, it can get really, really deep. So that's where we're going. Communication, chain of command, and then talking to thinking about whoever's on this healthcare team. And so are there any questions before we end for tonight? Because we haven't taken our 15-minute break. So we usually end at 6:50, well, 7:56. So we're at that time. So next week, communication, and then the next week we pull in the leadership. So week 4 and 5. That's where we're going. Okay. There aren't any questions. We'll see you on next week. Remember, the exam analysis take place on Friday at 5 p.m. Eastern Standard Time, shortly after your post grades.
Uh,
Thank
Professor,
you.
You're welcome. Yes.
Professor Phillips,
Yes, ma'am.
could you stay behind for a second?
Sure.
Thank you.
Mhm.
Professor, real quick, my dean told me to send you an email based on the situation that happened earlier. If
Hold
anything,
on.
just let me
Hold on,
know.
Miss Christine. I don't want to record
I can't hear
anything that
her.